There's a lot in the chat box for everybody, a lot of information of what has been on the call. The resources are there. I'll make sure that we pull it out and email it all to you when I send out the survey for this call. But I guess one of the questions that I'm still left with is how do we help when we find out we are connected to a survivor who still may be shy about what their experience was, but we know that their experience is important to be shared.
Right.
How do we get them to be advocates or mentors and all to other people?
You know, so I think if let's say you share a relationship with a child and you don't want to put your relationship at risk, or you just want to be anonymous, you know, you can make anonymous reports. Obviously, all of us that work with children, you know, we are mandated reporters. But for those that maybe don't want the child to know that the report came from you to preserve your relationship, you know, you obviously can make an anonymous report, and making those reports are important. Making it, you know, you can text the Polaris if you text Be Free, and you can just, you know, ask questions. They respond, you know, to you, and again, they maintain an anonymity, which is important. So you don't have to say your name or what you do or anything like that. And they kind of give you directions and guide you. And also being familiar with organizations like ours, the Citrus Health. Also, the Chance program is another program. We're always around and happy to assist and answer questions to teachers, to after school programs, to anybody that might have questions about how to take steps and move forward. You cannot, what we know with trafficking and with children is that we cannot do this work alone. We do this work collaboratively and as a community because there's so many levels and layers that are needed within the community. And Florida has been excellent in really kind of collaborating together to fight sex trafficking, you know, with minors. And we do have an MDT that takes place every 2 weeks where cases are staffed and discussed. And Miami-Dade County Public School System is a part of that, along with Department of Justice, state attorneys, FBI. We're part of that, DCF. So if something is going on with a child at school, we also can possibly get that information and discuss it with the person from Miami-Dade County Public School System, and we can take a look at what's happening within that child, the whole picture. You know, what's happening at school. Has the child ever been arrested? How many times has the child been truant? Has the child been through different services within the community? We can pick up all this information. So don't be scared or hesitant to reach out to us and just maybe let us know and say, hey, I'm worried about this child. You know, is there any way, I see some signs, I just don't really want them to know, but can you maybe see what's going on? And maybe that's a flag. And once we flag it, then, you know, we can really start figuring out how to move forward and proceed forward with services.
Yeah. So Yasmin identified as a survivor and an advocate. She's here on the call. I want her to just talk a little about what has resonated with her throughout this call today.
Peace. Thanks for allowing me to chime in. My first name's Sophia, and I work with Selah Freedom. If you're familiar, we're based in Sarasota, and I'm actually out here in Circuit 10. I'm really glad to even just be on this webinar today because previously I was in the Miami community, and I have a whole long story that I could do a whole webinar about how I recovered 4 missing girls who were abducted from Miami, and it was a mess, let me tell you. But fortunately they were recovered. So anyway, I am a full-time survivor mentor, and I've been in this field since graduate school. So for about the last 11 years, I've been working at Selah for 4. And basically it wasn't until my 30s that I even identified as a survivor. I did identify as someone who had been sexually abused and like taken advantage of, but I didn't understand that, you know, a lot of the dynamics about it, I worked on a campaign, or rather I volunteered to lead a campaign. If you're familiar with Sarah Cruzan, I co-led that national campaign to free her from her life imprisonment, which she was released in October of 2013. So in that process is when I actually started to put the pieces together and realized I wasn't just sexually abused, and there was a reason, a bigger reason why I was so drawn to Sarah's case and to support her. You know, I didn't know that people exchanging money, but me not having anything to do with it. And, you know, there were situations like that where I'd be locked in a room and there'd be an exchange of money, or I was a runaway child and I would be threatened and coerced to have sex so that I wouldn't be beaten or wouldn't be put back out on the street. So all of these things I just thought, you know, were normal things that happen to a child who's out on the streets. And unfortunately, I think they're unfortunately very normal things that happen to children who are out on the streets. So like I said, it just took me until my 30s to start to really process that and realize I was also a C-sex survivor and what that meant. I love everything y'all are talking about, and I really hope to network with you more. But the main things that really stood out to me were just when you were discussing like those vulnerabilities and that loyalty that survivors have. There is usually a core wound, from my experience in survivors of abandonment. You know, there is an abandonment issue, there is a neglect issue. So in that, unfortunately, not knowing what a healthy relationship looks like, we often tend to gravitate towards someone who somehow resembles someone who already abused us. And then we have a severe loyalty to that person because of our fear of abandonment. So I've really started to educate myself about attachment theory. And that's really, you know, begin to help me understand more. You know, there's the anxious type, the avoidant type, the secure. I think that that's a really excellent framework to begin to think about the behavior of survivors and the type. I also liken it to narcissism, like the avoidant or whatever could be like the narcissist. Of course, they're not complete parallels, but you can understand the anxious is like the caregiver, the empathic person, you know, the codependent. So those helping, you know, studying those things has helped me to understand that. And then I would say, you know, it's helped me. The other thing I resonated with is just the fact that, I mean, even that loyalty issue, I'm 38 years old, I still don't have children, I don't have a husband. Those are goals in my life. But there are reasons why those things haven't happened for me yet. Because I would continue to gravitate towards the wrong people. I didn't know what a healthy relationship was. And I honestly didn't feel like I could identify with a healthy person. To me, they were like an alien. Like, I don't know, like I felt really like a low self-esteem. Like I didn't feel like, you know, if you didn't come from the streets, I felt like I couldn't understand you and vice versa. So it took me many years to grow. And I was saying in the comment section that, you know, for me, I really had to severely isolate myself from any sort of social life. It may be unfortunate, but it was a part of my personal journey and healing process, because at least I was safe by myself. At least I could work on, you know, figuring out how to heal and grow mentally and emotionally, so that I would get to the point that when I step back into a social life, that I'm finally knowing what a healthy relationship looks like. I don't want to take more of your time, but I would love, I can leave my email in the comments. And if you have more questions, or certainly I'd love to continue to network with you all.
Perfect. Thank you so much.
Thank you.
That is so
Thank you so
powerful.
much for
Thank
sharing.
You are a hero.
Thank you
Yes.
for what you're doing. I
Thank
appreciate
you
you.
so much for what you shared.
So, and I
So
think, so Sophia and what she's doing and her being a mentor. So, you know, Project Gold is a survivor-led program, and it is so important. And survivors they are really the cornerstone of working, you know, with trafficking victims. So many of, you know, the law enforcement, or, you know, anybody that is trying to get survivors involved in services really struggles many times. And the key into getting them to start to accept services is through our survivor mentors, because they have been isolated. They have isolated themselves from the community and socially. And so when they see a survivor mentor, they understand this person, they get me, they understand me, and they can start to develop that level of trust. So the work that you do, Sophia, is so incredibly important, and everyone has to remember that a survivor mentor and working in this field, they are triggered every day. It takes such an incredible amount of strength to do what you do every day, Sophia, because anybody that goes through trauma, or we all have experienced some level of some sort of trauma, obviously not as complex as what Sophia has gone through, but if we were exposed to our trauma every single day and triggered every single day, you have to think of just the mental strength and really just the self-care that it takes. And it is just an act of love. So thank you so much for what you do, Sophia.
Yes, thank you so much.